Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Belzutifan versus Everolimus for advanced renal cell carcinoma. Background. Belzutifan, a hypoxia-inducible factor 2 alpha inhibitor, showed clinical activity in clear cell renal cell carcinoma in early phase studies. Methods. In a phase 3, multi-center, open-label, active controlled trial, we enrolled participants with advanced clear cell renal cell carcinoma who had previously received immune checkpoint and anti-angiogenic therapies, and randomly assigned them, in a 1-to-1 ratio, to receive 120 mg of belzutifan, or 10 mg of everolimus orally once daily, until disease progression or unacceptable toxic effects occurred. The dual primary endpoints were progression-free survival and overall survival. The key secondary endpoint was the occurrence of an objective response, a confirmed complete or partial response. Results. A total of 374 participants were assigned to belzutifan, and 372 to everolimus. At the first interim analysis, median follow-up, 18.4 months, the median progression-free survival was 5.6 months in both groups. At 18 months, 24.0% of the participants in the belzutifan group, and 8.3% in the everolimus group, were alive and free of progression. Two-sided p equals 0.002, which met the prespecified significance criterion. A confirmed objective response occurred in 21.9% of the participants. 95% confidence interval, CI, 17.8 to 26.5, in the belzutifan group, and in 3.5%, 95% CI, 1.9 to 5.9, in the everolimus group, p less than 0.001, which met the prespecified significance criterion. At the second interim analysis, median follow-up, 25.7 months. The median overall survival was 21.4 months in the belzutifan group, and 18.1 months in the everolimus group. At 18 months, 55.2% and 50.6% of the participants, respectively, were alive. Hazard ratio for death, 0.88, 95% CI, 0.73 to 1.07. Two-sided p equals 0.20. which did not meet the prespecified significance criterion. Grade 3 or higher adverse events of any cause occurred in 61.8% of the participants in the belzutifan group, grade 5 in 3.5%, and in 62.5% in the everolimus group, grade 5 in 5.3%. Adverse events led to discontinuation of treatment in 5.9% and 14.7% of the participants, respectively. Conclusions. Belzutifan showed a significant benefit over everolimus with respect to progression-free survival and objective response in participants with advanced clear cell renal cell carcinoma who had previously received immune checkpoint and anti-angiogenic therapies. Belzutifan was associated with no new safety signals. Liberal or restrictive transfusion strategy in patients with traumatic brain injury. Background. The effect of a liberal transfusion strategy, as compared with a restrictive strategy on outcomes in critically ill patients with traumatic brain injury, is unclear. Methods. We randomly assigned adults with moderate or severe traumatic brain injury and anemia to receive transfusion of red cells according to a liberal strategy. Transfusions initiated at a hemoglobin level of less than or equal to 10 grams per deciliter, or a restrictive strategy, transfusions initiated at less than or equal to 7 grams per deciliter. The primary outcome was an unfavorable outcome, as assessed by the score on the Glasgow Outcome Scale extended at 6 months, which we categorized with the use of a sliding dichotomy that was based on the prognosis of each patient at baseline. Secondary outcomes included mortality, functional independence, quality of life, and depression at 6 months. Results. A total of 742 patients underwent randomization, with 371 assigned to each group. The analysis of the primary outcome included 722 patients. The median hemoglobin level in the intensive care unit was 10.8 grams per deciliter in the group assigned to the liberal strategy, and 8.8 grams per deciliter in the group assigned to the restrictive strategy. An unfavorable outcome occurred in 249 of 364 patients, 68.4%, in the liberal strategy group, and in 263 of 358, 73.5%. In the restrictive strategy group, adjusted absolute difference, restrictive strategy versus liberal strategy, 5.4 percentage points, 95% confidence interval, -2.9 to 13.7. Among survivors, a liberal strategy was associated with higher scores on some but not all the scales, assessing functional independence and quality of life. No association was observed between the transfusion strategy and mortality or depression. Venous thromboembolic events occurred in 8.4% of the patients in each group, and acute respiratory distress syndrome occurred in 3.3% and 0.8% of patients in the liberal strategy and restrictive strategy groups, respectively. Conclusions. In critically ill patients with traumatic brain injury and anemia, a liberal transfusion strategy did not reduce the risk of an unfavorable neurologic outcome at 6 months. Next, we will be discussing articles from Journal of American Medical Association. Greenhouse gas emissions and costs of inhaler devices in the U.S., metered dose inhalers prescribed for asthma and chronic obstructive pulmonary disease contain hydrofluorocarbon propellants, potent greenhouse gases that trap heat in the atmosphere thousands of times more powerfully than carbon dioxide. In England, these inhalers contribute an estimated 0.8 million metric tons, MMT, of annual carbon dioxide equivalent, CO2e, emissions, one equivalent to 157,885 U.S. homes' yearly electricity use. 2. In response, the National Health Service, NHS, has encouraged switching from propellant-containing metered dose inhalers to propellant-free alternatives, such as dry powder and soft mist inhalers. Long-term prognosis of patients with myocarditis attributed to COVID-19 mRNA vaccination, SARS-CoV-2 infection, or conventional etiologies. Question: what is the long-term prognosis of myocarditis after COVID-19 mRNA vaccination, and do clinical outcomes and medical management differ from myocarditis of other origins? Finding in this nationwide cohort study including 4,635 patients hospitalized for myocarditis in France during the first 1.5 years after COVID-19 vaccination, the 558 individuals with post-vaccine myocarditis had less severe cardiovascular events than those with myocarditis of other origins at 18 months of follow-up. However, affected patients, mainly healthy young men, may require medical management up to several months after hospital discharge, meaning these elements should be taken into account for ongoing and future mRNA vaccine recommendations. Next, we will be discussing articles from Annals of Internal Medicine. Sodium glucose cotransporter 2 inhibitors, Dulaglutide, and risk for dementia, a population-based cohort study. Background. Both sodium glucose cotransporter 2, SGLT2, inhibitors and glucagon-like peptide 1 receptor agonists, GLP-1RAs, may have neuroprotective effects in patients with type 2 diabetes, T2D. However, their comparative effectiveness in preventing dementia remains uncertain. Results. Overall, 12,489 patients initiating SGLT2 inhibitor treatment, 51.9% dapagliflozin and 48.1% empagliflozin, and 1,075 patients initiating dulaglutide treatment were included. In the matched cohort, over a median follow-up of 4.4 years, The primary outcome event occurred in 69 participants in the SGLT2 inhibitor group and 43 in the Dulaglutide group. The estimated risk difference was -0.91 percentage point, 95% CI, -2.45 to 0.63 percentage point, and the estimated risk ratio was 0.81, CI, 0.56 to 1.16. Conclusion. Under conventional statistical criteria, a risk for dementia between 2.5% points lower and 0.6 percentage point greater for SGLT2 inhibitors than for dulaglutide was estimated to be highly compatible with the data from this study. However, whether these findings generalize to newer GLP-1RAs is uncertain. Thus, further studies incorporating newer drugs within these drug classes and better addressing residual confounding are required. Efficacy of a therapeutic pelvic yoga program versus a physical conditioning program on urinary incontinence in women, a randomized trial. Background. Pelvic floor yoga has been recommended as a complementary treatment strategy for urinary incontinence, UI, in women, but evidence of its efficacy is lacking. Results. Among the 240 randomly assigned women, age range, 45 to 90 years, mean baseline UI frequency was 3.4 episodes per day, SD, 2.2, including 1.9 urgency type episodes per day, SD, 1.9, and 1.4 stress type episodes per day, SD, 1.7. Over a 12-week time period, total UI frequency, primary outcome, decreased by an average of 2.3 episodes per day with pelvic yoga and 1.9 episodes per day with physical conditioning, between group difference of -0.3 episodes per day, 95% CI, -0.7 to 0.0. Urgency type UI frequency decreased by 1.2 episodes per day in the pelvic yoga group and 1.0 episode per day in the physical conditioning group, between group difference of -0.3 episodes per day, CI, -0.5 to 0.0. Reductions in stress type UI frequency did not differ between groups, -0.1 episodes per day, CI, -0.3 to 0.3. Conclusion. A 12-week pelvic yoga program was not superior to a general muscle stretching and strengthening program in reducing clinically important UI in midlife and older women with daily UI. Next, we will be discussing articles from British Medical Journal. Risk of dementia after initiation of sodium glucose cotransporter 2 inhibitors versus dipeptidyl peptidase, 4 inhibitors in adults, aged 40 to 69 years, with type 2 diabetes, population-based cohort study. Objective: to compare the risk of dementia associated with sodium glucose cotransporter 2, SGLT2, inhibitors versus dipeptidyl peptidase 4, DPP4, inhibitors in adults aged 40 to 69 years, with type 2 diabetes. Conclusion: SGLT2 inhibitors might prevent dementia, providing greater benefits with longer treatment. As this study was observational and therefore prone to residual confounding and informative censoring, the effect size could have been overestimated. Randomized controlled trials are needed to confirm these findings. Next, we will be discussing articles from Lancet. Antivirals for treatment of severe influenza, a systematic review and network meta-analysis of randomized controlled trials. Background. The optimal antiviral drug for treatment of severe influenza remains unclear. To support updated WHO influenza clinical guidelines, this systematic review and network meta-analysis evaluated antivirals for treatment of patients with severe influenza. Interpretation. In hospitalized patients with severe influenza, oseltamivir and perimivir might reduce duration of hospitalization compared with standard care or placebo, although the certainty of evidence is low. The effects of all antivirals on mortality and other important patient outcomes are very uncertain due to scarce data from randomized controlled trials. Antivirals for post-exposure prophylaxis of influenza, a systematic review and network meta-analysis. Background: antiviral post-exposure prophylaxis with neuraminidase inhibitors can reduce the incidence of influenza and the risk of symptomatic influenza, but the efficacy of the other classes of antiviral remains unclear. To support an update of WHO influenza guidelines, this systematic review and network meta-analysis evaluated antiviral drugs for post-exposure prophylaxis of influenza. Interpretation: post-exposure prophylaxis with zanamivir, oseltamivir, lenacapavir, or baloxavir probably decreases the risk of symptomatic seasonal influenza in individuals at high risk for severe disease after exposure to seasonal influenza viruses. Post-exposure prophylaxis with zanamivir, oseltamivir, lenacapavir, or baloxavir might reduce the risk of symptomatic zoonotic influenza after exposure to novel influenza A viruses associated with severe disease in infected humans. Next, we will be discussing articles in the field of hemato-oncology. Here are the SEN articles from Journal of Hepatology, 1-year transplant-free survival, following hospital discharge after ICU admission for ACLF in the Netherlands. Higher ACLF grades and increasing MELD score are associated with in-hospital mortality. Only a fraction of patients undergo liver transplantation within 1 year after ICU admission for ACLF. ACLF grade does not affect 1-year transplant-free survival after hospital discharge. Age, presence of malignancy and MELD score are more significant determinants of long-term survival. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Relative efficacies of TUN. Interventions to improve the quality of screening, related colonoscopy, a systematic review and network meta-analysis of randomized controlled trials. Background and aims. Significant variability exists in colonoscopy quality indicators, including adenoma detection rate, ADR. We synthesized evidence from randomized trials in a network meta-analysis on interventions to improve colonoscopy quality. Methods. We included trials from database inceptions to September 25, 2023, of patients undergoing screening-related colonoscopy, and presented efficacies of interventions within domains, peri-procedural parameters, endoscopist-directed interventions, intraprocedural techniques, endoscopic technologies, distal attachment devices, and additive substances, compared to standard colonoscopy. Conclusions. Several interventions are effective in improving adenoma detection and overall colonoscopy quality, many of which are cost-free. These results can inform endoscopists, unit managers, and endoscopy societies on relative efficacies. Here are the articles from Clinical Gastroenterology. Machine learning predicts patients with new-onset diabetes at risk of pancreatic cancer. Background. New-onset diabetes represent a high-risk cohort to screen for pancreatic cancer. Goals. Develop a machine model to predict pancreatic cancer among patients with new-onset diabetes. Results. In the test set, the XGBoost model had an area under the curve of 0.80, 0.76 to 0.85, compared with 0.63 and 0.68 for other models. Using cutoffs based on the Uden index, the sensitivity of the XGBoost model was 75%, the specificity was 70%, the accuracy was 70%, the positive predictive value was 1.2%, and the negative predictive value was greater than 99%. Conclusion. Machine learning models isolate a high-risk cohort from those with new-onset diabetes at risk for pancreatic cancer. Here are the articles from Journals of the American College of Cardiology. Clinical and analytical performance of a novel point-of-care, high-sensitivity, cardiac troponin I assay. Background. Point-of-care, POC, high-sensitivity cardiac troponin assays may further accelerate the diagnosis of myocardial infarction, MI. Objectives. This study sought to assess the clinical and analytical performance of the novel high-sensitivity cardiac troponin I, HSC-10EI, SpintShip POC test. Conclusions. The SpintShip HSC-10E POC test has very high diagnostic accuracy. Its assay-specific 0-1-hour algorithm achieved very high sensitivity/negative predictive value and specificity/positive predictive value for rule-out/NMI. From JAMA Cardiology. Plasma proteomics of exercise blood pressure and incident hypertension. Question: Are plasma protein markers of exercise blood pressure, EBP, also associated with incident hypertension? Findings. In the Health, Risk Factors, Exercise Training and Genetics, Heritage, Family Study, plasma levels of TGFBR3 were inversely associated with EBP, interrogation of TGFBR3 among individuals without hypertension from the Framingham Heart Study, Jackson Heart Study, and the multi-ethnic study of atherosclerosis, demonstrated that TGFBR3 is a novel circulating biomarker associated with a lower risk of incident hypertension. Genetically predicted levels of TGFBR3 were inversely associated with hypertension and cardiovascular disease, CVD, meaning circulating TGFBR3, a marker of EBP, was inversely associated with future hypertension risk in a diverse population and may protect against the development of CVD. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Testosterone treatment, weight loss, and health-related quality of life and psychosocial function in men, a 2-year randomized controlled trial. Objective: to determine the effect of testosterone versus placebo treatment on health-related quality of life, HR-call, and psychosocial function in men without pathologic hypogonadism in the context of a lifestyle intervention. Interventions: injectable testosterone under canoate, or matching placebo on the background of a community-based lifestyle program. Main outcomes: self-reported measures of HR-call/psychosocial function. Conclusion: in this diabetes prevention trial, weight loss induced by a lifestyle intervention improved HR-call and psychosocial function in more domains than testosterone treatment. The magnitude of weight and waist circumference reduction were predicted by baseline physical function, depressive symptomology, and sense of coherence. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Blood astrocyte biomarkers in Alzheimer's disease, a systematic review and meta-analysis. Background and objectives. Neuroinflammation, particularly early astrocyte reactivity, is a significant driver of Alzheimer's disease, AD pathogenesis. It is unclear how the levels of astrocyte biomarkers change in patients across the AD continuum, and which best reflect AD-related change. We performed a systematic review and meta-analysis of 3 blood astrocyte biomarkers: glial fibrillary acidic protein, GFAP, chitinase 3-like protein 1, YKL40, and S100B, in patients clinically diagnosed with AD. Discussion. We demonstrated significant elevations in blood GFA and YKL40 levels in patients on the AD continuum compared with CU individuals. Furthermore, within the AD clinical spectrum, significant elevation correlated with more advanced disease stage. Our findings suggest that both biomarkers reflect AD-related pathology. Our findings are limited by the lack of cultural and linguistic diversity in the study populations meta-analyzed. Future meta-analyses using a biomarker-defined AD population are warranted. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Research question: is using automatic mechanical ventilation, MV, feasible and comparable to the manual ventilation method during CPR? Results. A total of 60 patients were enrolled, and 30 patients were randomly assigned to each group. There were no statistically significant differences in basic characteristics of OCA patients between the two groups. The rate of any return of spontaneous circulation was 56.7% in the MV group and 43.3% in the BV group, indicating no significant, p equals 0.439, difference between the two groups. There were also no statistically significant differences in changes of pH, PCO2, PO2, bicarbonate, or lactate levels during CPR between the two groups. P-values equals 0.798, 0.249, 0.515, 0.876, and 0.878, respectively. Significantly lower tidal volume, p less than 0.001, and minute volume, p equals 0.009, were observed in the MV group. Interpretation. In this pilot trial, the use of MV instead of BV during CPR was feasible and could serve as a viable alternative. A multi-center randomized controlled trial is needed to create sufficient evidence for ventilation guidelines during CPR. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. A 6-year follow-up of bloodstream infections in hemodialysis facilities in the United States, National Healthcare Safety Network, 2020. In 2020, 7,183 hemodialysis facilities in the United States reported bloodstream infection data for over 5 million patient months to the Centers for Disease Control and Prevention's National Healthcare Safety Network. Pooled mean bloodstream infection rates per 100 patient months ranged from 0.12 among patients with arteriovenous fistulas to 0.80 among patients with central venous catheters. Rates of bloodstream infection were lower than predicted overall, and in almost all states and territories. Mechanisms of antihypertensive effect of chlorthalidone in advanced chronic kidney disease, a causal mediation analysis. Chlorthalidone reduces the amount of fluid and the BP, but fluid volume reduction is not the cause of lowering of BP. It is not volume loss, but the response to volume loss, such as the synthesis of substances that lower BP, is important. Here are the articles from Kidney International Reports. Pregnancy among women receiving chronic dialysis in France, 2006 to 2020 introduction. In women receiving chronic dialysis, fertility is impaired. The objectives of this study were to estimate the incidence rate of pregnancies among women of childbearing age, 15 to 50 years, receiving chronic dialysis from 2006 to 2020 in France, to describe the pregnancy outcomes and renal management during pregnancy. Methods. This national observational, retrospective study was based on data from the French RAIN registry, matched with the National Health Data System. Conclusion. There have been improvements in maternal and fetal outcomes regarding pregnancy on chronic dialysis. However, our study shows a significant proportion of elective abortions. Better fertility management of women receiving chronic dialysis is advised by contraception or by pregnancy planning and early multidisciplinary follow-up. Here are the articles from Kidney International Reports. Pregnancy among women receiving chronic dialysis in France, 2006 to 2020 introduction. In women receiving chronic dialysis, fertility is impaired. The objectives of this study were to estimate the incidence rate of pregnancies among women of childbearing age, 15 to 50 years, receiving chronic dialysis from 2006 to 2020 in France, to describe the pregnancy outcomes and renal management during pregnancy. Methods. This national observational, retrospective study was based on data from the French RAIN registry, matched with the National Health Data System. Conclusion. There have been improvements in maternal and fetal outcomes regarding pregnancy on chronic dialysis. However, our study shows a significant proportion of elective abortions. Better fertility management of women receiving chronic dialysis is advised by contraception or by pregnancy planning and early multidisciplinary follow-up.